Yeah, cool. Good evening. We are here to discuss motor neuron disease, as requested by John van Wyk, presented by Dr. Pienaar. It's a progressive degeneration of nerve cells from the brain to the muscle, leading to paralysis to death. There's 3 different patterns of involvement. One would be progressive muscular atrophy, progressive bulbar palsy, and amyotrophic lateral sclerosis. That's why we're here. So, clinical feature of motor neuron disease. Most present after 50, very few before 30. There's more males than females. Some symptoms: stumbling, weak grip, cramps, muscle weakness, and speech disturbances and swallowing problems. Your signs would be wasting, fasciculations of muscles, weakness of muscles, of limbs, tongue and palate, exaggerated tendon reflexes and sensory deficit. Also, no intellectual impairment is usually noted. You should exclude most other diseases like especially diabetic amyotrophy, spinal disorders, and multifocal motor neuropathy. So some investigations. Diagnosis is strongly supported by a combination of upper motor neuron, lower motor neuron, signs with involvement of more than 2 limbs, or a limb, and bulbar muscles. Prevalence is 5 to 7 per 10,000. So some tests we can do: CSF, your protein would be slightly elevated. On your imaging, spinal imaging, brain scanning, to exclude, of course, any other disease or cerebral diseases. And then we also can do some sensory nerve and motor conduction tests. Management: physiotherapy, occupational therapy, and speech therapists. Some of the drugs, as you would know, is Rizol, and then of course analgesia, and supportive medicine. This is to prolong life and quality of life. I nominate Francis Ntora, Enzo Schuler, Nicola Filipov, Paul Coetzee, Adrian Riffoot, Gerard Pienaar, Janus Malan, James Morrow, Nelien van Velde, Warren Meyer, Rico Rousseau, Leanne Dix, Shani van der Merwe, Elsa de Bruin, and Tinus Marais, and Johnny Grenier. Thank you. And this is my ALS bucket challenge.